Late yesterday, we shared that the province has modified Directive Number 2, which was the directive telling us to ramp down surgeries and other procedures. That directive has been modified, enabling hospitals to resume services, although it's qualified that we have to do so in a manner, of course, that is safe and that is not putting undue pressure on inpatient resources and our ability to respond to the potential for further demands on our services as a result of the virus.
We did open 38 beds across our adult ICUs in efforts to support the critical needs, the ICU needs of COVID. So we have 43 patients in those 38 beds. That's far less than our planning for 15%. We are planning upwards of 160 beds through our COVID peak for our 15% capacity. So we really have seen those ward numbers come down. Because we still have that ongoing pressure in our critical care areas, those 38 beds will remain open.
We are pretty close, I would say, to the best case scenario, but the decrease that we've seen in ICU beds that we need after being steeper first than predicted has plateaued off somehow, for which people have multiple explanations. One certainly being the long care that some of the folks that are in the ICU require. There might be a tendency to move patients on non-invasive ventilation who used to be on the ward, now being moved to the ICU because there's a little bit more capacity there. But the ICU remains the bottleneck provincially as well as locally.
In response to the healthcare community to allow for an acceleration of second doses for the highest risk group of healthcare workers. That starts with text and email messages that are going out to those eligible, and it's been identified on the basis of the date for second dose, which would have aligned with the risk level. Those email and text notifications of a rescheduled second appointment are going out through today. If an individual who believes they are eligible in those groups does not receive that text or email notification by the end of today, then starting tomorrow morning, they can contact a specific phone line, and it goes through the public health system, but then goes to a designated tree to have your second dose rescheduled.
All in all, I think we can leave today's meeting feeling pretty good about the direction that we're headed in.